Come on in, fibromyalgia friends. We are live and we're about to showcase some information about our organization. What's up, support fibro friends? Welcome. It's Monday. So I do have a case of the Mondays and we're going to get started. It's our Giving Tuesday special, but we're having it on Monday just because of all the things that are going on and the fact we've both had terrible sleep. So this is going to be an adventure, but you're going to want to stick around. You're going to want to hear what is going on, not only with Giving Tuesday, but the conference. And we have a special giveaway today for these orbs, and we're going to learn more. I guess we'll find out exactly what they're called: fascia orbs, fascia release orbs. We're going to learn how to use them on Saturday, December 2nd at 11 a.m. Eastern with Jill. So today we're giving some away, and we have a special word that you're going to have to use through the broadcast. So let me show you what this word is. You're going to type it in, and then we're going to have a raffle at the end. So right now, no one is entered. So we need you to share and send it because you'll definitely want to grab one of these kits so you can enjoy what we learn on Saturday as well. So let's get back to our presentation really quick too. And here we go. So I am Melissa Talwar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach.
And I'm Brandy Privatera, and I'm the director of programs. Melissa, am I having feedback at all?
No, you're good.
Okay, good. Because I'm also having Mondays over here. But like I said, I'm Brandy Privatera, director of programs. I'm also a certified families health coach. And that's it.
We are definitely having a case of the Mondays. We are prepping for the conference. It's huge. There's a lot going on. And of course, like, I'm so glad that no one can smell me right now because I did sleep wrong. And that sounded wrong too. I did sleep wrong. So I smell like eucalyptus all over. It's one of those things where you get twisted and you feel it. And so that's why I'm excited to try figuring out how to use these orbs, because I know I've seen some videos where she is like running it across her face, although I feel like I need it on both sides and right here right now. So that's
You're smelling like eucalyptus and I'm smelling like peppermint because I also have cream on me to help with the aches and pains as well.
And that is why we have our conferences virtual, everyone. Not only can you join in your pajamas and be comfortable at home, but it's okay if you smell like eucalyptus or peppermint. No one will ever know. And that is why it's cool. And that is why we love our virtual conferences and need to encourage people to do more virtual workshops and things. So that's an important piece of the puzzle. Oh, look, Fibro Nerds. Yes, use the hashtag Fibro Nerds. So you will be entered in. I know we'll figure out if you live overseas, how to get you the giveaways. And I need to talk to Carrie. It's good to see you. Carrie, you're going to have to help me figure out international giveaways. So we have people posting the Fibro Nerds already. So at the end, we're going to do the giveaway and it'll automatically do that. We are practicing using the software for the upcoming conference so that we can give these away. There's going to be other opportunities to win the orbs as well. And to those of you, there's going to be a special giveaway if you remember what finals I have to take during the conference. So I'm going to start off microbiology and biochemistry. So if you remember one of those on Saturday when I asked that question, you'll have to return. You'll get a very generous giveaway. So I'm going to repeat. I have to take, during the conference itself, I have to take a microbiology and biochem exam. So if you do remember that, I'll definitely give you a generous giveaway on Saturday, December 2nd. Stick around.
And thank you, Carrie, for don't press the duck reminder.
Oh, that's going to be a reminder for all our speakers backstage, and you're going to see some ducks throughout the conference. I think we're changing maybe our mascot should be a duck, and we'll figure this out. So we all flock together, and we're going to have a lot with a pause for fibro as well. But let's open it up because this is Giving Tuesday is tomorrow, and we definitely need your support out there. To all our fibromyalgia friends, a big, huge thing that you can do right now is to follow our pages and our accounts in social media and share with your other fibromyalgia friends. We just got back from ACR, and a lot of the doctors, some of their remarks, and you have to try not to internalize it, was, "We've never heard of you before." Or we had one doctor approach our booth and he said, "Wow, you're doing a lot of amazing things. You need to get better at marketing because I had no idea you existed. And we need our patients to know." So, with that said, we could definitely use your help in spreading the word on all the work we're doing, and sharing with all of your fibromyalgia friends, your groups, and other people you're associated with that could use this help, especially our upcoming conference, because it is virtual and it is free. So that's what this presentation is going to be more about today. That we're going to kind of go over, and I'm going to go quickly through it, so we can share some of the programs that we're doing. It's not extensive, and there's a lot that we're covering and a lot that we're expanding on for 2024. And we'll get to the questions at the end. I see, Sonia, you're asking this. So let me just pause because I got distracted. Is this a video conference? Yes, this is all virtual again. So you can come in with your comfy pajamas and slippers and eucalyptus and peppermint tree oils, and you can watch all virtually. It's 10 days. So we are launching this Thursday, November 30th, with our special guests, Liz, Lo, and Frank. They'll be on with us for our kickoff event. And then the following day, we're going to get started even more. So it's 10 days. There's going to be content every single day up through December 9th. And then we have additional fun time that's going to happen too outside of the conference through potentially a Zoom link, which will have more information for you. This will be more of a game night. So it's all virtual. You can attend from anywhere you're at. You may have to adapt the hours as we're adjusting, because we've put it on Eastern Standard Time, and I'm in Pacific as well. So I'm with you, but everything will be online for you to watch. Oh, see, there's the hours. Sonia, the hours are from every day. Every day from 10 a.m. Eastern to 3 p.m. Eastern time. But there's going to be some game night stuff that'll fall later on in the evening. And Saturday, December 2nd is particularly, there's going to be dual events going on. So we have in the morning, again, from 10 a.m. to 3 p.m. Eastern, there's presentations. And then we'll be back later in the evening for some fun. And you'll get to see the presentation from Carrie and Fibromay later that evening as well. So we'll figure out the timing. Right now, I can only convert in Eastern time because that's how I've memorized it. And so we'll come back with more information, and we'll be sure to keep sharing. Stay tuned. If you're subscribed to our YouTube channel, all the content, every single minute of the conference will be streamed on YouTube. So just keep your eyes posted. If you go to the streams or the live tab on YouTube, you'll see all the videos start to pop up. You can click to get notified, so that way each day it'll notify you when we go live. But all the streams will be available on the watch page. So if you go to fibromyalgiaconference.com, we've embedded a video there, so you'll be able to watch there. If you do want to interact with the content, every single minute will be available on YouTube itself and StreamYard. So there's a StreamYard link also available on the website right now for fibromyalgiaconference.com. And you'll be able to enter into the StreamYard and be able to post comments and things just like you would YouTube. So a variety of ways. Some of the content will be streamed throughout the week also on Facebook for our friends out there. We are limited on time, so that's why we've chosen YouTube, because they don't restrict our length of time, and some of the other things. But we'll be everywhere on the internet, so please share the content with all of your friends. Okay, so back to the presentation. But I know the conference is actually super, super important, so spread the word, and we want everybody to watch. So we are a national nonprofit organization. We have been established since 2017, so we are completely established with the IRS and all of that fun stuff that we have to do a lot of paperwork for. And we do a lot of focus on bringing the community together, but our attention gets focused on patient education, medical education, advocacy training, research expansion. We are developing group coaching and health coaching integration, as Brandy will be board certified next year as well. And she's currently a certified families health and wellness coach and launching more groups as we team up also with medical providers across the country to implement group medical visits. Again, here's a lot of the patient services where we focus in on. This is a capture from the Support Fibro Tour. You'll see us now that we're back in action on the road with booths. We'll be at setups in local areas. I know Brandy's excited about this because she loves to set up booths and have fun. So we'll have educational workshops. We have live interviews coming. We do offer resources to support group leaders so that they can get up-to-date resources on fibromyalgia. This could include anything from worksheets, digital worksheets, and downloads, which we'll be adding more to our website shortly. And then also books, like up-to-date books, because I know both Brandy and I love to read. And Brandy, you also have a new book about TMJ that you're reading that we need to add to the list, right?
Yes, and oh my goodness, right before we went on, I was like, "Let me grab that book just in case it comes up," and I was like, "No, I can't do those stairs again. My body can't take it." And now I wish I would have done it because this book is so insightful because it comes from a patient perspective and really with the language and everything and being able to understand it. It's quickly become one of my favorite fibro resources for books.
Well, and that's the thing. We want to spread awareness because there isn't one thing that helps every single, well, I mean, there isn't one thing across the board that people have found relief in completely. So we have to spread these resources and share as much as possible. And we recently got introduced to more airway issues that may come up through the oral pathways, TMJ, a lot of this stuff that we hadn't really associated as much with fibromyalgia. But because of the Demystifying Fibromyalgia conference with Dr. Ron and his friends, we were able to learn a lot. And there is a lot going on with our teeth, our jaw, and this whole system up here. So if you have a lot of jaw pain going on, a lot of shoulder pain, you get these points, that stuff might be very interesting for you. So that's why we're creating this content and making it available for everyone, spreading the word. More interviews are definitely coming your way. Another area that we support the community with is with Inspire the Fibromyalgia community online. And I'm going to let Brandy share a little bit about this. She is heading up the Inspire community there. You'll find us both there, and Brandy actively posts content for the Inspire community.
Yeah, so Inspire is currently the world's largest online health community and is growing daily. It has many different communities for chronic pain, lupus, arthritis, and all of those various conditions that we have. Support Fibro specifically leads the fibromyalgia community. You can join for free, or you can also post anonymously. We have posts within the fibromyalgia community that is for members only, as well as public. So your privacy is of the utmost importance for us and the Inspire community. What we like to do at a bare minimum is have one discussion going per week. However, we have multiple conversations going on to just be able to help one another and share in our fibromyalgia journey, whatever aspect, whether it be family or help with your medical providers, how to do advocacy, how to connect with your family and friends, how to tackle those new symptoms or ongoing symptoms, flares, what have you. We even have fun discussions because, that's how I cope with a lot of my issues is through fun and positivity. So there's a lot of fun questions like sharing your favorite Thanksgiving dish if you celebrate Thanksgiving. What are some holiday hacks that, you use to be able to get through the holidays and that sort of thing. It's highly engaging. We have over 18,000 members and we are growing on a weekly basis. I dare say a daily basis, but I'm not sure. I haven't looked at the numbers. But we are having a lot of engaging conversations, and we do sometimes share these public posts out onto the community to be able to get people to get back into that Inspire. Like I said, there is a privacy and confidentiality. So we make sure that we are very clear about that. And it's just highly engaging and uplifting and being able to bring the community together so that we know that we're not alone. Like it says on the screen, together we're better, because it's just better when we're doing it together and we don't feel so isolated and alone.
Absolutely. And some of the differences too that you may see within the community as is that not only Brandy and I are in the fibromyalgia community, there's other disease communities also that you can be a member of. And then the Inspire team also has moderators, which, if anyone has experienced all this spam, which they seem to be out like in abundance yesterday with all of our posts, it gets really tedious. So the fact is that you can be a part of a community that feels safe. You don't have to use your real name for the handle, which is fun, and we encourage people to have a little fun with it. And then you have this respect too, and people are moderating comments. It's not a place for spam and promotion. It's a space to engage each other and have real conversations about what's going on with fibromyalgia, similar to what you may see in a Facebook type of group, something like that, but without any connection to the Meta system. And Meta, we love you, but sometimes we need a different space to go to. So you'll definitely get registered. It's free to go over the community. We have links everywhere, so we'll be sure to continue to share with you so you can join us there. We'll be adding some Ask the Experts. So we did talk to some medical providers also at ACR about being experts in the community and bringing them in for particular weeks so they can showcase and you can ask questions in a forum type of state, not video, but it's posting so they can be helpful to the entire community. Again, resources, we're talking about the Fibromyalgia Community Conference. So your support and donations do help keep these topics and these conferences free. We do have to pay for software, and it is challenging at this point. We are looking for technology that works. I'm all about pushing technology to its limits, right? 10 days. I don't know why we chose 10 days, but we had to push multiple days, and we are pushing it to the limits of integrating other software, but something is never perfect. And last year, if anyone was there, we had some issues with the registration as well, and we sold out. They only allow a certain amount of people that can join. So this has been my rivalry with these event software platforms. They are very costly. They charge you by like person by head. So it's really hard for us to spread and actually spread the message to all the fibromyalgia community. And it's a challenge. So we integrated software this year, but it is a cost and we do want to keep these free. So for next year and things like that, keep in mind if you know of people that would be interested in sponsoring or donating to keep supporting these conferences available for you, that would be awesome and very much appreciated. It does take a lot of work, and everyone is also volunteering their time right now, even all the patient advocates and community advocates. So we want to give back because we want to make sure after the 10 days we all don't crash out necessarily, which I feel that may be coming for all of us soon. So we're keeping all of this work available to everyone so it'll be accessible. It's affordable for everybody to get as much of the education as they need because we know a lot of the education falls onto the laps of the fibromyalgia patients in order to research and figure out and implement.
There's something I want to add about the Fibromyalgia Community Conference. When we were at ACR and we were letting everyone know, anyone that stopped by our booth, we were letting them know about this conference. And there was usually two questions asked. The first one was, is this free? And we said, yes, it's everything we provide is free and it's virtual. And the feedback from that was, wow, there's not a lot of conferences that are free nowadays. So we like to highlight that it is always free. The other question that we got asked a lot was, well, who is this for? Is this more for the patients or is this providers? We say it's for everyone that is wanting to be involved with the fibromyalgia, whether it be the patient, their medical provider, their allied professional, whether it be researchers, advocates, support group leaders, or even our loved ones and friends that want to be more involved, or you want to be able to share more information. So this is for everyone. This is not just for one group of people. This is why we call it our community conference, because this is about bringing everyone together and being able to level all of us up.
And our speakers include everyone as well. So we have healthcare providers, allied professionals, researchers, and international community leaders all on one stage, which is unusual. But this, with our conference, you don't have to fight over getting the patient advocates on the stage. It is naturally a part of the process since that's what we do. naturally and collaborate. And we're excited to continue to collaborate with all of these advocates. We also support the other organizations and advocates that we work to. We team up on different campaigns around the holidays, gifts, gift boxes, etc. So that's why this is important and meaningful for all of us to continue doing the work as well. Collaborative care is a completely new project. Because we are health coaches and we understand group visits, which we did a presentation at ACR and we got some good response, and we are hearing from medical doctors. We really feel like we are creating a better solution for fibromyalgia care. So this is something that you're going to hear and see a lot more of in 2024 as we rally the medical professionals. It was really good to see and be at ACR with our booth. And we're going to have a better recap at some point because it was good information. I wasn't sure going in if the rheumatologists were going to run away from us, but we were inundated with questions, and rheumatologists actually came to us, which was phenomenal. And very honestly, I was surprised, much more surprised. And they were really engaged with having conversations because they want to create solutions. They know that there's gaps in care. They know that there's struggles with treatments. All the treatments that they were trained for 10 years ago, we know now aren't as effective as they need to be. Some people feel like they get good results, and the rest of us can't even take them. So they understand that there is a need. Now, how do we create solutions? So this is where this fibromyalgia collaborative care is going to come in. It's going to unite all the healthcare expertise to come in and evolve. And we're going to start putting these patient care solutions out there for everyone to try to experience. It is a huge lift, but we're very inspired by some of the other training that we've received and the medical doctors we've been working with to better understand this. One is Dr. Ron at the Texas Center for Lifestyle Medicine, leading this idea as well. And we've inspired some other healthcare providers to also get involved, which is really, really exciting. So stay tuned for more on this in 2024. Group coaching also goes into this collaborative care model. Ideally, we will be talking to you about group medical visits, partnering with medical physicians. But in the network itself, with our organization, we want to bring back the group coaching aspect. I know I forget the year, but we launched during all of this when we went virtual. There was a couple groups that did some group health coaching, and at the time it was focused on accessibility to with food to integrate into that, and found out that we had better results just focusing on group coaching. So we'd like to expand this as well in 2024, open up groups that have a variety of content that can focus on a variety of ages as well and different topics. Bring this in with Brandy and myself leading various groups, and we would love to continue to grow this, add some more board certified health coaches to the mix so that way we can expand these groups and get more patients in, and you can see what group coaching is all about. And do stay tuned for a group coaching video during the conference where we're going to get into more details of what that looks like and some of the goals moving forward as we expand this service. Again, tying back into the collaborative care, we want to do some medical education. We're finally got some doctors be like, yes, I want to educate other doctors, because that's what we were missing. In order to get the continuing medical education credit approved, we need these MDs to actually approve our written content. So I'm probably overly excited because I've been talking about Project Echo for a while. It is one of my favorite programs that I've been looking forward to, because this is initially why I even talked to Brandy about starting a nonprofit besides patient services, was training medical physicians. There is definitely a gap. We need to get medical physicians the training and updated information. As we said, when we trained in the past of fibromyalgia, we were always training rheumatologists. They had the training went through when innovations came out with like Lyrica and things like that. So it's old. It's been a long time, and we need to figure out solutions for fibromyalgia patients. We'll gather up the doctors that do want to learn, especially in primary care. That's a huge focus, internal medicine, primary care, every local region. Our first goal is to launch the Echo with training, and our second goal is to at least train one medical provider that takes insurance in fibromyalgia fundamentals in every single state. So we need at least 50 or more providers. I'd love to have more. And again, accessibility, affordability. We know there's providers out there that do cash pay concierge services. They're welcome to join too. But a lot of our focus is trying to get insurance to cover these resources. So we'll be talking about that too in the future. Advocacy in Action. This is a huge program, and we're developing an education portal that we're also going to be launching in 2024. So stay tuned for that. We will be going back to the Hill in March and then having a virtual training in May. And Brandy, this was one of the programs we didn't expect to even have on our list, but we did it. And Brandy and I had successful meetings in the summer. So you've seen the results of the changes that we're been creating with advocacy.
Yeah, this is the action part of awareness that, is true to all of our hearts, because awareness is great, but it cannot act on its own. Everything comes with the balance, a yin and a yang. And that's where advocacy comes in. It's the action, it's taking that awareness of the problem and actually doing something about it. And so we went out on this venture, and we didn't know how to do it. And we just figured it out as we went along. We've had some great people being able to do it with us and be able to, work out the process with us. And we've been to the Hill virtually and in person, as Melissa said. And the feedback we got was phenomenal. From the very first time that I sat down at a table and talked to my state's representatives all the way to today, we've always had some kind of feedback saying, hey, this is great. This is what we can do with it. Or this is how you can make it better. Or this is what we're looking for. But there was always a genuine interest in what we are doing, how we are living, how this affects our lives, how fibromyalgia affects our lives, and what we can do to make it better, what they can do, our legislators, what they can do to help make it better. These are real people that are sitting up there with our interests in mind, and they want to make us happy. They want to make their state's residents happy. So how can they support us? And I was just really overwhelmed and grateful for that positive feedback, because honestly, I'm usually an optimistic person, but I was just trying to be realistic about it. They really don't want to hear us. How are we going to make it? But it was so easy to just go in there and tell them our story and say, hey, this is what's going on. This is the awareness. Here are some ways that we can solve it. Here are some ways that we can come together and be able to create a solution to this problem. And it's been overwhelmingly positive and just very encouraging to keep going forward. It gets really tiring. It's very exhausted, but it fuels us to keep going.
Well, and our congressional representatives, they want to hear from us as well, and they excited to hear from us. They like to hear from us over any of the lobbyists, and they are surprised that the funding for fibromyalgia is so low. So they have also advised that we got to keep at it. They know it's a long journey and there's a lot that goes into it. We were successful with getting a line item in it. So we are moving, we are making progress. Now, progress can feel a little daunting, but we are making the progress, and it all relates right back into one of the biggest features that we still need to push forward is research. And this is huge for our organization in expanding research, having conversations with researchers, getting researchers excited about fibromyalgia and new research and thinking outside the box type of research. So we've been having a lot of conversations with people who are affiliated at the NIH. We went to a conference this summer as well. So we were part of that. Brandy made a new friend too at the NIH at the ACR conference. So we have been talking to researchers. We have a page on our current website that showcases some surveys and other ways we've been involved in research as well. I do want to point out too, when we talk about research and we're funding for research, there's different ways to do it. So we are pushing more advanced funding at the NIH to open up and increase the funding so that researchers can get into that as well. There is the philanthropic way, which is possible, and I know it does take dollar donations. But I do want to mention to our entire fibromyalgia community, because I've been around in this community for a while, more than I'd like to say, but research was always used as a marketing term. And so here at the organization, I want to be really transparent with everyone, and I have to say this. anything that goes with the funding of fibromyalgia, you will know where it goes. And for all of the surveys, too, we've been reaching out to people and we've been following up. We're trying to encourage the researchers to actually come on to do a recording so we can share. There are humans behind the research, and this is important so we can follow the progress. That way, you stay connected with what's going on. And if there are any dollar donations that go on, you always know where it goes and what it's being used for. So, that is an important piece of this puzzle because I know for some reason in the past, a lot of fundraisers were like, oh, we're going to raise money for research. And then we had no idea where it went or how it was utilized. So that's going to end. That we're taking action. We can take action and be accountable for ourselves as an organization. And I want to share that with everyone because it's really important for me that we connect this and expand research. I've been very disappointed and I'm starting to see glimmers of hope. There is glimmers of hope. And I get excited over research. So bringing in new researchers and talking about it and getting that information out there is important because research ties with everything. And as we talked about, even medical education, we need to be able to train medical doctors in new things. So we're going to need that research to verify because everybody says evidence based research. So this is why it ties back into research and it's important. And this is also why advocacy, using your voice, talking to the congressional leaders is also super important. So these stakeholders need to know that they can invest in fibromyalgia community. There is an active voice going on for the community, so their investment will be well utilized. And we need these tools because we need it to translate to all of you in your households to help you feel better and help you manage with what's going on with your fibromyalgia symptoms as well. So it all keys together. It's a lot of work, but we're ready for it. We're active, and I'm excited about 2024. I'm nervous at the same time, but this is huge. We need this. We're dedicated here as an organization, and it's really important to us. We also expand with research surveys. We're going to be moving to another portal to actually conduct these research surveys to help with some of the questions that are coming up individually from fibromyalgia. We hope to get more of researchers involved with this so that we can ask questions that matter to fibromyalgia. If you've seen some of the research surveys, it's different. So we want to target things that actually, that you want to know more about is happening. And we have some intriguing questions also for that as well. So that's it for my presentation. For Brandy, anything else you want to add?
Yeah, I wanted to go back to the research part and just say that when we went to the NINDS nonprofit forum over the summer, we sat down at a table and talked with researchers specifically about fibromyalgia and said, hey, what's going on with this fibromyalgia research? And we got a lot of encouraging feedback. And one of the things the researchers said is they want to get the researchers out of those labs and talking to the patients. And we asked, how can we help make that connection? When I was flying over to ACR from the East Coast to the West Coast, I was sitting by a researcher at the NIH. And when he actually saw me reading that Linda Harris book that we were talking about earlier about the connection between fibromyalgia and TMJ, and he said, are you a doctor? And I said, no, this is what I do. And I told him about Support Fibro and kind of find out he's a researcher at NIH, and he had a lot of specific questions, like from a patient's perspective. And he would ask a lot of questions about fibromyalgia. And I was telling him about the awareness and the advocacy and what research could do to answer a lot of those problems. And he agreed. And he even said, how do we connect more with the patients? How do we get that conversation going? If I wanted to do X, Y, and Z, how can your organization help me get to those patients and get that feedback that we need? So this is very encouraging for our community. This is saying, hey, there's researchers are out there. They're helping us. They're trying to figure out what's going on. They're trying to make those same changes that we are. There are people out there that are trying to connect those patients and those researchers, and we're helping to try to bring all of those together. It's really important that we have this conversation going. And even though you may not hear a lot about it and you may not see those conversations, they are happening. They are happening behind the scenes. And we're trying to bring that out to say, hey, this is what's going on. So don't give up hope. It's happening. Melissa, are you there? Did we freeze? Or did I freeze? Uh-oh. I don't know if I'm freezing or she's freezing. Could somebody let me know if I'm still on or we're still on? Oh, okay. So we think Melissa is frozen. No, don't do this. See, this is technical stuff that we come together great for because she knows all the technical stuff. Uh-oh, she's gonna come back. So again, if there's any questions that you have, just let us know. Melissa's internet is acting up, but I'm sure she's logging out to log right back on. All of this that Melissa is sharing right now are some reasons to be able to support our nonprofit, even if you're not able to make a donation. If you just comment on our post, if you share it out, share the word about what we are doing. We know that there's just a lot that needs to happen here in the fibromyalgia community, and we are working within the community to get all of that. Hi, Melissa.
Welcome to the world of technology.
So that's
So I'm glad Brandy's gonna have to get used to this because hopefully with the conference this doesn't happen. I knew the internet. It's Monday. It is Monday, folks. So there's definitely a case of the Mondays going on. I was hearing bits and I loved what I was hearing, Brandy. So where are we at right now? Is it time? I lost the giveaway page.
Oh no, I was just reaffirming what you were saying about how people can get involved. Even if there's not a donation that someone could make, they can comment, share what we're doing, share the word. And I was asking if anyone had any questions with what we were saying today.
Fantastic. That is awesome. And also, don't forget to type in hashtag FibroNerds so you can enter into the raffle. We're gonna try it again. Yes, I'm seeing the comments too. Brandy, like, it's you just got to keep going with the with it. It's one of those days, and it's gonna be an adventure this week. But regarding the conference, if anyone has any additional questions, please let us know. So we are launching on November 30th at 3 p.m. Eastern time. So we'll kick off the event. We have some very special guests that we are excited to introduce you to. And we're going to have some great conversations moving forward throughout the whole conference. We have healthcare providers lined up, community leaders lined up, everything, like researchers. Oh yeah, you got to share your shirt. Okay, so what is this shirt about?
So I don't know if you can really see. You might see my PJ bottoms, but it says "Sassy Speculum." It says "Made me a Vagenius," and so this is in regards to the Sassy Speculum podcast that is by Dr. Noor, and she's going to explore a little bit about how all of this incorporates into fibromyalgia when it comes to that. And I just thought it was just like a really cute shirt, and it's a way to support those people that are supporting us. And I also got some bath salts to be able that she makes herself with herbs, and it's supposed to, be really relaxing and all of that. So I haven't used it yet, but I'm just excited about having it and being able to support someone at the same time. So I wore this today. I mean, and look at the glasses. Isn't that amazing? That goes along with our nerd theme that we have going on.
I know. I didn't even ask her if she's a fellow nerd or willing to, but we'll
She
ask her.
is. She
Uh,
is.
I know she has your sense of humor, so I'm living on the edge that I'm actually going to be in an interview with you and her at the same time. So I'll try to be quick with how I understand the jokes. I'm very slow. Humor is not my strength. I'm a very literal person, so I tend to miss humor. And but I'm excited. She definitely has a podcast. She'll be speaking at the conference this coming Friday. So Friday, December 1st at, let me get this correct, 1 p.m. Eastern. So we have Dr. Pinkston in the morning at 10:30 a.m. We have Chloe Jones, who is part of the research team at the neuroinflammation lab with Dr. Younger. And then we'll have Dr. Noor up right after. So that's going to be our fun day for Friday. And we'll get into more of the details of the panel. So go to fibromyalgiaconference.com. You can find all the links there. You'll see some of the speaker headshots. We're going to be adding some more blog posts with complete schedules so they can view more, learn about the podcast, learn about there's a lot of authors on the stage too. And we'll have the schedules posted with some bios and more information, so you can get as much information as you can about the conference moving forward. Again, the multiple ways that you can definitely watch every single minute of the conference is fibromyalgiaconference.com. The landing page right there will have a video every single day. There'll be a stream and it'll be posted there. And if you want to interact like you're doing right now, in it, some people last year didn't want to see the comments, so that's why we gave a streaming option for other people. But if you want to interact, participate in giveaways, ask questions, and connect with other people in the chat, then definitely watching on YouTube. So if you go to the live tab that's on our YouTube channel, you'll see all the videos start to compile. You can always click notify, so you'll get notified every time we get live. So this is for 10 days straight, but if you keep that open, you'll be able to see all the streams. So YouTube is the place to be all the time. And then StreamYard. So you'll be able to join us within this StreamYard platform on air, which is you'll be able to interact. And then you might catch some behind the scenes because we'll end the stream in social media and we'll continue to chat in StreamYard too. So you never know what happens behind the scenes. And that link is also available on the fibromyalgiaconference.com. So if you have to remember one thing, just do that. And then we have YouTube and StreamYard links also posted there. Some of the conference will be streamed through Facebook when it's a couple of videos, and that's generally during the week and later in the evening. So we'll be everywhere. Please share our content with everyone. We really want to reach over 1 million viewers. We won't be able to sell out this year. At least last year we sold out. It was annoying because we wanted to reach as many people as possible. I didn't think we would sell out, so we weren't prepared for that. So this year I don't believe there's any way for us to sell out. We might break the internet though. I'm ready to break the internet. So let's bring millions of fibromyalgia friends from around the world together, so that everybody can watch the conference. And again, it's on the internet. It'll stay on the internet as long as we don't break the internet. And you'll be able to see the full conference and replay. And then after the conference, we're going to take everyone's individual interview and we'll do post-production. Hi, Mike. I know you're not happy with that. And we'll put it up, individual interviews too, all over the internet. So this content will be available for everyone to continue to watch, continue to refer, and continue to share, as long as everything with StreamYard. So internet and StreamYard, as long as we don't click the ducks, we'll be good. So I'm going to try this. I'm going to try to share this again with the shared screen for the giveaway tool so you can watch how this works, because we want to get really good at this. So we're going to need more entries for you guys during the conference. But for this giveaway in particular, you can see there's no favoritism, and we'll send you the orbs. If you do live in another country, we'll have to figure this out. So I need help with giveaways if you live overseas to try. But this way you'll join us on Saturday. You'll see Jill present. We'll be giving away these. Again, these are for fascial release. And I'm going to do this quickly because I see the internet not happy with me. See how it goes through? Let's see who wins. Look at that. Okay, so that's how it's done. We're going to continue with the giveaways all throughout the conference. You're going to see this happen, and hopefully it doesn't, the internet will let me do this. And this, so Cassandra, if you can send, we need to figure out, so we'll get you these orbs so you can have it. So we'll send those to you from Amazon. There's an orb kit. I'm only showing one of the balls, but you get a kit. Some of it comes like there's other balls in the kit. So we'll show you how to use it on Saturday, December 2nd with Jill.
That is so fun, Melissa. I love this. It had confetti and it like went through and like, oh man, that just fueled me. Like, oh man, I love that.
Well, and apparently you can do multiple giveaways, although it looks like I didn't set it up right. So we'll learn throughout the conference how to do this and how to utilize it. More giveaways to come, more keywords to come. And especially just again, remember there is a huge giveaway going to happen on Saturday, December 2nd. If you remember microbiology or biochemistry, those are two exams that I have to take on Tuesday, December 5th in the middle of all of this. So I have a special giveaway for the person that joins and remembers to one of those courses. So thank you everyone for attending. Okay, let me see. Will you send notifications? Okay, so you can get notifications from like YouTube. So I see you're joining in from YouTube. If you do click on the stream video itself, there's a button on the video itself that says notify. If you were one of the people that registered, we will be sending you email notifications, not every day because I know that's annoying, but that is one of the main reasons we originally asked people to register was that we could send them updates to information about the conference because it's 10 days. And apparently, we have to change the StreamYard link for all 10 days, which is going to be fun for all of us as co hosts to try to remember and hopefully don't click on the wrong link or the wrong duck. But we're going to try to make it easier. Just remember, we will be on YouTube for all 10 days to make it simple. Those of you tuning into from YouTube right now, stay on YouTube. If that's what you find helpful and interact, it's going to stay the same. So all the content will be streamed on YouTube as well. Hopefully that's helpful. There is so you can view there is an app to like join through StreamYard and we can post it. But again, it might be easier for everybody. Just this is why we decided just to stream on YouTube to make it easier for everyone to view it because we know those features exist. And then you can view it. We can try it and test it. So we'll post the StreamYard link and maybe we can test it if you're around on November 30th. You can join to see how it works for you, but there's always backups. We have backups upon backups and backups.
3 more days. I was about
Oh
to do
my,
this, but this is 6. This is 3. Monday.
I know. Okay. So I think that's it. Are we a wrap? We're good? The
We're
internet?
good.
Okay.
Yeah.
Okay, I'm going to get off before the internet kicks me off again because I have a bad feeling that's coming soon. So, thank you, everyone. We will see all of you shortly. Please, if you're out there and you have a moment and you want to create a Facebook fundraiser for Giving Tuesday, we would really appreciate it. Or add to even $1 donation or donating your cup of coffee would be super helpful to our organization. Every dollar matters. We appreciate you. You are loved and you are part of this community. So we will see you for the Fibromyalgia Community Conference. Thank you. Bye.
Bye.